Welcome back to another episode of Planet Forward with Preetha, Conversations for a Greener Future. Today, we have the privilege of speaking with Archana Padmakar, Deputy Director of Emergency Care and Recovery Centers at the Banyan. Archana is a clinical psychologist with a wealth of experience and a profound commitment to mental health advocacy. Holding a PhD from VU Amsterdam, she has been at the forefront of designing and implementing user centric psychosocial interventions. Her career includes significant contributions internationally, including work with the Luxembourg government and the Portugal embassy, and as a consultant clinical psychologist at Christian Medical College, Vellore. Since joining the Banyan in 2013, Archana has dedicated herself to transforming the landscape of mental health care for the most vulnerable. Today, she leads efforts that are pivotal in shaping emergency care and long term recovery strategies, greatly impacting lives through innovative health solutions. Archana, thank you so much for joining us today to share your invaluable insights and inspiring work.
Thank you, Preetha. I think it's a privilege to be part of this podcast. I'm really happy to share my experiences with the Banyan in terms of serving homeless people with severe mental health issues. So thank you very much.
Thank you so much. I'm so happy to have you here. So the first question, I want to ask is, especially you have a lot of experience working outside of India and working in several organizations. And then in 2013, you came to Banyan. So I want to first ask, could you start by telling us what drew you to the field of clinical psychology and what motivated you to focus on emergency care and recovery?
So I think that has a lot to do with my childhood as well. So my parents also are all psychologists. So I have a lot of people in my family who contributed towards the mental health sector. And I have grown up in the CMC campus. Wow. And we used to do, so I and my other friends, we used to do our homework in the ECT room. So we used to be a lot more accommodative of the fact that, yes, we grew up with this fact that people can be different. People can have mental health needs. And I think I also grew up in a home where people are much more accommodative and open to these concepts. So thereafter, I don't think I really had a clear direction of whether I wanted to do psychology or something else. But I did see a lot in my mom and dad where they did reach out to people whenever they were in distress. And since I grew up with the CMC fraternity, and I think I wanted to work there as well. And that has been my key motivation to kind of being drawn towards a clinical sector as far as mental health is concerned. And therefore, I got into psychology and I got into other paramedical services as well. But then I think I was much more drawn towards psychology and wanted to work in CMC as well. It's also because that I think as a child as well, I was allowed to volunteer with people with Hansen's disease, with people with mental health issues, and also people with cancer. So at the age of about 10, I think, my parents encouraged me to volunteer on the weekends with different groups of people, both caregivers and people who are undergoing treatment at the Christian Medical College, Vellore. So I think that's what has shaped me as a person, where it makes me understand the need for emergency care, especially for people who cannot afford.
Understood.
Especially for people who come from marginalized communities. I think because CMC also renders its service to people of this kind. And I think that I understood that access to care is a huge problem in our country. And therefore, also me coming back to India this decision was also drawn towards the fact that I knew where I'm supposed to be.
That is so inspiring, what a beautiful childhood you had. You had such inspiring people as parents in your life growing up. And then, you have been exposed to so many things in the society, which very seldom children get to see at a growing age. That's the reason why mental health is considered taboo for the most part in our countries, because there's no such exposure and it's considered to be something we should keep behind the walls. But you, on the other hand, had a completely different exposure, and which also helped you go and, you know, do a lot of research on that. And then you made the final call, no, I have to come back to India because there's a need that this particular care is not equally given to all different socioeconomic background individuals. So I love the way you started and said it. It's so brilliant. So I think now I want to ask about the personal connection to the mission of Banyan, right? Like, I know you went to, you were in Amsterdam, and then you were Christian Medical College, and then you came to Banyan. So throughout your career, right, especially in places such as diverse as Luxembourg and Vellore, how have your personal values and experiences shaped the way you approach your work at Banyan? Because I'm looking at it from, like, you work for the for-profit sector and then you've come to a non-profit sector such as Banyan. So your lens is different. So how do you, how is your personal values and experience contributing to that?
That's a very interesting question, Preetha. And I think as an individual, I think for me, as a person, I've been a very systematic child as well, not just an adult, but that's how I started off, I think. And right from my seventh standard autograph books that I had to sign off, I always signed up as a clinical psychologist. So I had everything in place, one after the other, as in what I wanted to do in life. But I think in terms of values, I think um, as a person, there's a lot of acceptance that I have towards diverse groups. So that helped me to kind of work with different kinds of people. And also at the Banyan, if you see, that was at a different level, I think, because I thought that I have the threshold, a decent amount of threshold to accept people from diverse groups. But what I got to see at the Banyan was, I think acceptance was at a different level altogether. My lens regarding acceptance itself kind of broadened further when I joined the Banyan, because I think this is the core organization that works with, I think, under marginalization of people. Under that, it's ultra poor. It's ultra
Wow.
marginalization, the kind of group that they work with. So it's not just about people where below the poverty line or whatsoever. Under that, there are different categories of people where probably it's beyond having 3 meals a day, it's beyond having a mental health issue. But how do you hold on to someone towards the end, having a continuity of care as far as mental health care is concerned for people who can't afford, but something that really stretched my value systems in terms of how I could tweak my level of acceptance, how I could accept myself in terms of stretching myself so much towards people who are in so much distress, and also with regard to unconditionality, because it's very difficult to kind of be having an unconditional attitude towards people, especially persons with personality disorders, and also for the fact that they need that sort of support. So people here at the Banyan, I mean, the clientele is very different because we do not focus on professional boundaries so much as far as concerned, only because you'll have to travel with this individual.
Yes.
So far in my medical training, in my theoretical training, what I have been taught and the way I have been trained is where it's robust clinical training. And beyond that, you either want to access treatment or not, and that's it. But we have not looked beyond the walls of a hospital, beyond the walls of any sort of a clinical sector where we want to understand the individual, why this person is unable to access care, why is this person unable to come for his or her follow ups? Why is this individual so difficult? How do you understand the home environment? How do you work beyond the individual to understand the community this person has come from, the cultural background this person has come from, the kind of early childhood trauma this person has gone through? Therefore, a lot of associated factors probably inhibits a person from even accessing care. Understanding those factors was something that probably did not come through during my training as a student, therefore, as a professional as well, to be very honest. But I think when I came to the Banyan, seeing the sync between true journey of one's life and also merging that with your clinical training is a fantastic combination because it's just not about hearing an individual. You're under no pressure in terms of, you will have to get this person better, but rather it's about traveling with this individual because the journey of a homeless person, Preetha, is very complicated.
Very
It's
complicated.
beyond mental health. Yes, it's beyond mental health. It's beyond an individual psyche. It's quite a journey because
So many other
uh,
factors like the trauma they go through because of their economic conditions
yeah,
and their family issues. So you just can't look at them from, oh, they're having a mental issue or a mental illness, but they have other factors which contributes to it. Unless you fix all that, they are the whatever medications or whatever you're giving from a clinical standpoint is only temporary. After that wears out, they're still in that particular environment. So you have to completely change the environment they are in order for them to survive. So how do you take, at least this is what I'm learning from all the people I've interviewed thus far at Banyan, is like, how do you ensure that they approved it from that particular environment, treated well, and find another place wherein they can thrive, right? So like you said, the journey is so important. You have to I think for the past guests I've spoken thus far, they said there are people who've been at Banyan for many years, and it's not like you rightfully said, it's there's no hurry to cure them in like 3 months
yeah.
or 6 months. You guys are like literally dedicating a long time in order to ensure that they're completely cured and they're able to survive on their own, if at all they have to go back and assimilate with the society.
Also, for the fact that the pathways to homelessness has been changing over a decade, and that's very interesting because if you see so, um, the people who have decided to leave homes, the precipitating factor is not their mental health issue, is not their poor coping mechanisms. But people have taken the decision, women have taken that sort of decision over a period of time, and that's brilliant. So we cannot owe the journey of homelessness only to a person's poor coping skills or ill health or because of a specific mental health issue, but because I'm done with this rotten marriage. I'm done with this abusive home environment. I'm done with this man who does not help me to grow in my life further. I'm done with this life where my children are hitting me. The children are very abusive towards me. My in laws are physically assaulted. So people are taking this sort of stance, and I'm very happy about it because there are no clear answers for women in India over a period of time, not at all taking a stance where women are so fragile, therefore they cannot take a stance. I'm very proud of my mother who's been a very strong individual. I'm also very proud of several other women in our country who've taken that sort of a stance to kind of stand up for themselves. But it's not the case, especially when people especially when women are raised within a box, saying
Yes,
that
100%.
you attain puberty, you get married, and then you procreate, and therefore you live under the shadow of your children. Now this is changing. Women are seeing things differently. Women are seeing their physical needs differently. Women are seeing their needs in terms of financial autonomy, in terms of autonomy, in terms of even living arrangement. They don't want to share a space with somebody who's so abusive. They do
Yeah,
not
you're
want to
right.
share with somebody who's abusive. So if these are also the reasons, I think it's good for us to work with such individuals because you're so tied up by the cultural heritage. There are pros and cons in terms of the cultural heritage that we have in our country, but despite that, there are also a lot of flaws in terms of how the system views a woman's decision making skills. Okay, how the system views in terms of how a woman takes the stance on, okay, I'm not interested in this man anymore who's part of an institutional marriage, but rather I would rather want to see another man who has much more friendship. This
Mm-hmm.
relationship is much more richer when compared to an institutional marriage which has certain protocols that I need to follow, and I'm not happy within this relationship. not at all fostering or endorsing a valueless kind of a system. That's not what I'm intending to say. But rather, it's very important for us to change our mental health interventions based on individual needs because the world is changing. The
Yes,
environment around you is changing. So you cannot just follow the checklist and checkbox and say, yes, I've done this, the distress is gone. No, people are aspiring more than ever before. People
absolutely.
want more from relationships, from your economic stability, from your housing stability. People want different things. They want many choices. Now, mental health is not so simple. Mental health is a journey there again. So, therefore, fitting their needs into a user care paradigm is quite a challenging thing, Preetha.
I know, absolutely. And you rightfully said, right? Like you cannot have like a one size fits all kind of approach at all. Each person's story is different. Each person's background is different. Each person's circumstances is different. So you have to adapt to that particular individual. Especially you said, right? The needs are changing. The needs are different from individual to individual. So you taking all
Absolutely.
that into consideration is like a really challenging, but I think you guys are doing an amazing job. Like you said, Banyan is the only place where you found that even the lowest and lowest of people in the socioeconomic hierarchy is taken care of, right? Now I want to just getting into your core work, what happens at Banyan, right? Like you design interventions. That's something which you are passionate about, and you're known at Banyan. So I want to know, like, you lead the design of psychosocial interventions at the Banyan. So, could you share with us the process of creating these interventions? Like, how do you ensure they are user centric and effective in real world settings?
So basically, the broader themes that we have, if you see, Preeta, is this is acute mental health services that what we're trying to probably offer, and identify situations of precarity. So predominantly, it's homelessness, but at the same time, we're also looking at other aspects like crisis support, emergency care, access to safe spaces, because women need to access safe spaces, right? And also residential care and collaborative care. And thereafter, there is planning and aftercare and continued support once the person leaves the facility. So while the person has access to care within an IP center, within an inpatient center, what we currently do is we have certain SOPs in place, but what we've done is to design certain intervention packages by a multidisciplinary team. So
Okay.
we have psychiatrists, we have clinical social workers, we have clinical psychologists and counseling psychologists. And the larger bandwidth of the program is run by our healthcare workers, who are about 60% of our human resources, who are also being recruited from marginal backgrounds. And as you know, there's a huge mental health resource gap. So which means that it's not affordable for an NGO to all the time recruit people who are only qualified. But rather, what we've done is you have a different layers of cadres, right? So within that, as far as healthcare is concerned, we've recruited people from the local community who also have family members with similar kind of distress, probably. We got to know only after they come into the system, but their sense of innovation and their sense of creativity brings in, it's like a cherry topping over the designed package that we already have, because I can come in only with a certain restricted way of looking at a problem. Okay, but then since they have a clean slate when they walk in, they have a better way of in terms of addressing a problem or probably responding to a very harsh stimuli or probably responding to certain types of distress. So we have a combo of nursing care, psychiatric, social, psychological, continuity of services along with medical care and social care. So our focus is not just on medical care, but also on social care. Like I think how other colleagues of mine would have already explained to you. So as part of our interventions, what we have is we have basic screening in terms of as soon as a homeless person comes into a facility, there are a lot of things that we need to look into because their mortality rates are very high. Their
Mm-hmm.
morbidity trend shows that a lot of they're prone to more infections. compared to a general population. Like, for example, cardiovascular, respiratory conditions, premature aging, high frailty scores. All these things are quite common, a prevalent among the homeless population. And they also have higher self harm rates when compared to other the general population. And the rates of hospital readmissions is also higher. Now I'm very clear about the category of people that I have in hand, right?
Okay.
Now, considering that these are the problems that people walk in with, in addition to the social indicators that we already discussed about poverty, we also
Yeah.
discussed about gender, community, caste, all of that also plays a huge role. Now, weaving in these individual factors plus the community factors put in together, we have a design package for community outreach as soon as you walk into a facility. So even before you get to see this inpatient center and all of that on the streets in terms of what sort of package you have for somebody who needs to access medical care, who needs to access social care. How do you engage with this individual while this person feels that I'm much more safer on the street? That's one category of
Category.
homeless
Okay.
person. Another category of homeless person is where, hey, I definitely need help. I was just waiting for somebody to come and knock at my door. I'm here on the pavement. And if you can take me to the nearest medical center because I've been running with fever and probably I have breathlessness for the last few days, we straight away take them for medical care. The third person is where this person is contemplating, saying that uh, I do not have a mental health issue, whereas this person has a mental health issue.
They're
So this
not in
person,
acceptance mode yet. They haven't accepted that they are going through something.
yeah. And their reality is their reality. One is about acceptance. But
Yeah.
even before we jump into acceptance, it's my reality that if I'm in love with the prime minister of the country, if I think the president of the country is my wife or whatever, then it's my reality. So I don't need anybody to accept the fact that
And
this
that
is
is
what
what they
they're
believe
going
in.
through.
That is what they believe in.
That's what I believe in. So it takes some more time for the mental health professional to sit beside them, to have a cup of chai, to engage with them, to earn that sort of trust, saying that, okay, can I help you to access some sort of care, some sort of basic amenities? Okay, that's one package where you buy in them, but in a very polite way, gentle way, and also with great emphasis on dignity. So not just dragging them, bringing them into the facility, but rather sitting with them, having a dialogue, negotiating what's possible, what's not possible. Also explaining about pros and cons of you staying here on the pavement and coming along with me. You can always make the choice of working out of the facility whenever it's possible. So this is what happens in your
Wow.
community outreach. Okay, and in your community outreach, what we also do is to support people with a nutritious meal, or if they require a warm bed, or if they need sleeping mats, or if they need additional clothes, or I need dry snacks. These are the things that we have mapped across our city. So you know, in a particular zone, if you meet A, B, C, D person, you will know what sort of needs they would require. So that is taken care of. Now, once this community outreach is done, then we bring in a person, there are certain legalities that we need to follow. The next package that they are exposed to is where there is basic screening done, basic nursing care that is done, because they're also, as we just discussed, they're also prone to a lot of infections, right from hepatitis to herpes simplex, virus to syphilis to many sexually
Men,
transmitted diseases as
yeah,
well.
that's what I was just
Because
going to ask you also, right? People who are living on the pavements and they are
yeah,
exploited also, right? Especially women, they're exploited.
absolutely.
So, and
They
you,
are raped more than
exactly.
exploited, they're forcefully sexually assaulted on the pavements. There are women who walk in pregnant. There are women who are probably beyond the second trimester, and then we
Oh
get
my
to
God.
see them. That is also possible. So now, very recently, we've helped a woman to deliver a baby. She walked in pregnant. It was not possible for us to medically terminate, and she wanted to keep the baby as well. So it was her decision. So the child just turned 1 month old. She
Oh
had a
my
daughter.
God. That's so
She was
precious.
taking care of the baby. as well. And in the past, I think we've kind of raised about 13 children, out of which one is married now. Two more to go, who are almost at, I mean, three more to go, who are almost at the verge of getting married. They're all settled, they've done masters. Banyan has supported their education, has supported them psychologically, and also we're like a close network. We're like a family. Like my daughter is friends with them. They come home for sleepovers, for vacation. So it's, I think you can cut this
Wow,
part of it, but
that is so sweet.
it's very
Just
it's very
to
precious. I'm not
just
saying it
because
for the podcast.
no,
They
that's
really
so
deal with
sweet. Especially, imagine if the moms, if they were not rescued by Banyan, imagine the life of these children. What would have happened to them? They would have been on the streets as well, just like their moms. But Banyan just completely transformed their lives, right?
yeah,
They came to
yeah.
mainstream, and they have hope that they also can live a decent life on this earth versus getting
Yeah.
exploited on the streets. That's amazing. Oh my God, I'm just getting goosebumps just listening to you. Thank you.
So they are much more part of our system. That's something that I can definitely say that it's a family together. So having them over, or our children going to their place, all of that is quite a blessing, I think, to be part of the journey as well. Coming back to the IP center, once they come into the IP center, so basic nursing care is done, basic medical care is done. Now, these interventions are very common in any hospital, if you understand. There's nothing so great about it. But what's important is taking the consent of a person with a mental health issue, especially if this person comes from a homeless background, is very complex. It's not easily doable. So, which means
Okay.
for a woman who's been sexually assaulted on the streets, and if you want to sit with this woman and then touch her, to examine her, it's quite a task.
She
Okay,
won't trust
because
anyone.
um, it takes a long time for somebody to build in that sort of trust towards someone, and then to have that sort of a cordial relationship. I mean, why would even I wouldn't do it? If you want me to remove my clothes and if you want me to examine me, I don't think I will be quite. I mean, I don't even want to come from a homelessness background, but even then, it will take some time. You have your own inhibitions. Imagine asking a total stranger, you're standing in front of a total stranger, asking them to examine all of that. So our teams are trained in a particular way to kind of take it easy with them, to kind of deal with them, to kind of negotiate, to have certain communication styles, to understand their needs, because their medical needs that you get to see visibly is negligible when compared to the kind of trauma that they've been through. So for me, probably their tuberculosis is most important thing that I need to attend to. But for them, it's like, who do I connect with? Where is my anchoring? Yes, I've come to this place. I have access to basic amenities and all of that. But where do I anchor myself is quite a is a kind of a question that I think is a lot of ethical dilemmas as well. I would say, Preetha, in terms of which one do you prioritize?
Exactly.
Like
I was just thinking through
when
in
do
my
I
mind.
when do I exactly draw a line and say that yes, I have ensured this person is feeling safe? What does feeling safe mean?
Means, your definition of feeling safe is different versus that person's definition. So there's no any standardized definition for that.
No, because my sense of safety is far more different. Even now, Preeta, as we are talking, it takes some time for us to understand each other, right? It's not
Absolutely.
like
Like
I'm
the
just
style of
info
conversation
out
and
of the
all.
blue. Yeah,
Yeah.
yeah, the style of conversation, and then you're maintaining that sort of eye contact with me, your tone, right? Your so all of this also makes a lot of sense. So in clinical practice, again, dealing with somebody who's so fragile as they enter the system, taking care of their needs, which is stemming out of many multiple factors, is quite a thing. So that's how your packages, again, is I would not proudly say this package is a very with a robust protocol. It keeps changing. It has to change. You have to be open to change and keep, like, there are clients who say that I don't want to take medications. I mean, I don't even need to be part of the system. For 6 months, we've not forced them to take meds. We've allowed that to happen. Give that sort of time for an individual to think, to decide and to take a call on how do you want to be treated in a mental health care facility, because more often when people leave mental health facilities, what really goes along with them is how badly they were treated when they enter a mental health facility.
Because that's all what the
So,
society is exposed to, right? The kind of traumatic
yeah,
hospitals
yeah,
which comes out in media, they show how they treated, and the kind of environment they are put in. So people are having those kind of thoughts always when they think about a mental facility, and they're like, oh, am I going to be treated the same way? That itself is a fear factor. They have to overcome that.
and and for the fact that over a period of time, so once the nurse sees them, the psychiatrist sees them, the general physician sees them, then you have the social worker and the psychologist playing a dominant role in terms of spending time with them, having individual sessions or group sessions to understand how the. So we are, as an organization, we are not just focused on the individual. We're very happy to have peer advocacy as part of a system as well. So, which means that as a clinical head, I'm quite open to clients giving me feedback about, hey, your staff is not behaving well with me. Hey, your system of menu in terms of what sort of nutritious meal, that probably is nutritious meal, but probably I live only for 2 more years and I want to have what I want to have. So people want to give that sort of feedback. People want to be on the same page. So if you don't create this sense of equality within a mental health institution, you will never be able to probably show this person during this brief period of stay, to show this individual, yes, this is possible. You can be treated with dignity, is something that I'll keep lecturing. I'll keep talking about. But unless you live and show the way it is, it's very difficult for the individual to take back that message, and also probably to be a role model for the other individual wherever they are. So
It's
we
so
want to
beautiful.
sow in the
You're showing them that they also matter. I'm going to value you as a human being, and their feedback, like you said, right? It can be something as silly as the food is not nutritious, but like you said, the food is nutritious, but in their vantage point, it is not. But you're willing to accept it, understanding them, and their views are also, that itself is a huge recognition for them, which they have not had in the past from the environment they come in. So you recognizing and say, okay, your values are taken into consideration. You're respected for whatever you are. I think that's another, as we as individuals itself, right? Irrespective of you have a mental illness or not, we all want to be respected and valued. Our inputs are taken into consideration, no matter where the organization we are part of, or even at home for that matter, right? We all want to make sure that we are valued. So I think you are approaching the right essence of what a human being wants to do. At least this is how I'm interpreting what you're saying, and that actually helps. You're not going with this textbook version of how the mental health care facility needs to be operated. You're going in with experiences, like you said about the peer treatment, wherein you're allowing another person who also has gone on, who's underwent the similar trauma and who's completely cured now, to actually sit with a new client to show them the ropes. That is a very innovative way as well, right? Because they've been there, done that. They know exactly what the journey is, and they know how to converse with them much better than what probably the nurses could do. I'm just thinking through it, because I'm processing everything what you're saying, and this is what I infer from that. It's such a brilliant way to make them feel comfortable and gain their trust that this is a place where they can feel safe and they can be safe.
And in addition to that, let me share a case study with you. This is, we lost a client a week ago. I think that was on Wednesday, I think. So this client has been with us for about 7 years now, and we found her family, and then the family also moved in, and then so they accessed our home again care option. And exactly a year ago, uh, parents and the daughter moved out, and they rented out a house, and they had gotten a solid amount of money because they had lent it out to some of their relatives, and they got back that money. Therefore, they had the solid resources to live together. And then we continued to stay with them because mother had a mental health issue. This child in the sense she's about 40, who also had a mental health issue. The father was caught up between this relationship, and she was also mother to about 10 dogs, and she was taking care of the 10 dogs plus parents. None of them worked. None of them had a system in place where they would get up in the morning, go for work, and come back. But rather, they prefer to live on the expenses, and then they would come to Banyan whenever they would need. They would need extra clothes. They would need access to food or other things. And we continue to support the social care in terms of financially supporting them whenever it's required. Now, this girl has taught me a lot in terms of we used to have also a lot of complicated conversations between us, because she would always come from the lens where, Archana, do you think everything is going on well in the mental health sector? She would start off with that sort of a question. Are you very proud about the fact that many people are being reached out through the services and all of that? And then when I would ask her, as in, why would you feel this way? And then she would say that as soon as you people walk into the gate of the hospital, I want you guys to shred off your qualifications, shred off
Oh,
who
wow.
you are, designations, shred off the fact that you come here to save somebody's life, but rather walk in because we need a buddy in life. Walk in because we've lost the only friend that we had because we had a mental health issue. Or become that family because we lost families, the kith and kin whom we were supposed to grow up. That's what our cultural practices talk a lot more on. Marriages have failed. Children have given up on us. Become that to us rather than being professionals,
Oh
rather than
my
being
God.
practitioners, and creating that hierarchy, saying that, oh, you have bipolar, oh, you have schizophrenia, oh, you have a mental health issue, but rather become the person whom I want in my life. And I think that will contribute a lot more to my recovery than anything else, more than medicines,
What
more
a
than
blessed
therapy.
soul for her to say such a profound
Yeah,
message. That indeed is the
yeah,
truth, right? And oh my God,
yeah.
may her soul rest in peace. I'm so,
So on Tuesday, her mother died last Tuesday. So we brought her back to the Banyan, and then um, I was leaving to Bangalore the next day, Preetha. It was a very, I'm still processing this loss. So Tuesday, her mother died, and then we brought her here, and then over calls, both Dr. Vandana and were in touch with her. Our team was there to support her because the dogs are also sensing it. They've lost the mother.
yeah,
The only primary caregiver is now moving out of the house. Imagine, it's very difficult for even the dogs to process. The next day, I told her the next morning, I'm leaving to Bangalore, but I'll come and visit you before I leave to the airport. Then I come in the morning to see her, and then I wake her up, and then she's no more. It was quite a difficult thing for me to process
oh
the
my
fact
God,
that
I'm so sorry.
I'd come to see her to say bye to her, but um, I think she did not find any meaning after she lost both her parents. I think, um, and because she kept saying that, Archana, I think I'll go back to the same place where my parents are. I don't have anybody else to look forward to, and I kept saying that, Varsha, this is a new beginning. Probably we're all there.
Yeah,
Probably we can do something about it. Okay. And she had a massive cardiac arrest. She's of my age, she's 42, but she had a massive cardiac arrest, and it was difficult to. We gave CPR. It was a very tough thing. Now, the reason I'm bringing her story here is because there are people who have stood for their stance in terms of how they want to access their services, Preetha. And it's not simple. It always comes from a place of hurt. It always comes from a place of deception where people have promised and have not delivered. And that's
that is
what
what.
I think healthcare all over the world is being questioned about. And it always has two sides. And unfortunately, when there are in betweens like us, where we are trying to make a change, where we are trying to understand what's going on, but still you are being labeled under the same overarching caption saying that, yes, all mental health care facilities are like this. they have power, they have hierarchy and whatnot. But I would definitely vouch for the Banyan, where I think nobody else. She also accessed other facilities
Yeah.
in Chennai,
So
which is
sorry,
what she
I'm so
needs.
tearing up
But
just listening to the story because I can only imagine what she must have gone through, right? Like, that is the true
yeah,
essence
yeah,
of you get so hurt because of the deception and all the things. People take advantage of the others, naiveness, and that
yeah,
causes the
yeah.
mental health. And that's the root cause of all that. And so sorry, I'm so tearing up just listening to
No, it's
poor
okay.
thing.
Thank you for that gesture. I think that only renders support to me, because
Sorry.
I'm also in a similar state of mind, because I really thought that we can work with her, we can take her along, we can have a complete new beginning, and then that's that. And I didn't know that I was gearing towards the end of her life, and how uncertain life itself can be,
Yeah,
Preetha.
exactly.
What are we
Life
even
is
talking
so.
about? Yeah, what are we even talking about the sector, the healthcare paradigms, and whatnot? But if a person has come to a point where okay, there is no hope, there is no point in moving forward, and that's the decision she's taken, and in a way, I'm so glad that she she died with
Archana,
some sort of.
can we? Yeah, yeah, yeah. Now I got it. In between, your video just completely went away. Sorry.
Um, so in a way, it was quite complex to even to work with people of this sort, where sometimes a lot of options that you have, the packages that you have, does not suit them at all, because what they want is a life similar to us. That's also there, where you're not in a position to give all of that, but you can only tell them a sense of direction. Definitely, it's there, sort of care packages that I have. But I wish I had all the money in the world to give what
What
people
they
want.
are
But
want? Yeah,
yeah, what people want and how they want to live their life. But unfortunately, we have access only to public money, and that's limited. And the
limited.
people
Yes.
of this sort, of her, we have 100 more of this sort. Then how do I even gauge, and how do I even kind of satisfy all the 100 people whom we have in hand with similar needs that they have? So in terms of packages, I think for us, the DNA of the package is very important, Preeta. I think what I bring to the table as a psychologist, what I bring to the table as a social worker is not important. But are you able to bring in the value systems of the Banyan into the care packages is very important.
Important.
Okay, now for example, I have given a slot to meet a client A at 10 a.m. The client says that I'm not coming in because I don't believe in what you're saying. Instead, can you come out with me for a cup of coffee?
But that's okay.
I
Maybe
think
that's
that's
exactly how they want it.
okay.
And
Yeah, and that's the sense of flexibility you need to have as far as your practice is concerned, as far as your psychosocial intervention is concerned. Not at all demeaning the essence of clinical practice, but clinical practice can be a little bit more flexible. It can be more user friendly. It can be more user specific. Then I think it really works well. So you also bank on persons with lived experiences in terms of how you want to tweak your packages. I think that's very important as well. So when you bring in a homeless person into the IP center for the first time, what people have told us is don't bring us in with a group behind us. Bring me in because this is a nice place. Help me to understand it's a nice place. Don't just say it. Make it look nice.
make it look nice. So they feel good about it, right? The feel good factor is
Yeah,
also something they're looking
yeah,
for. Very nice.
yeah. So what we have been focusing on is cleanliness of the hospital. It needs to look more professional. You need to have a reception. You need to have a nurse. You need to have a head nurse coming in. But what they're seeing is somebody to walk along, hold my hand, walk along, make the ambience more friendly, make the ambience more safe rather than you saying it. Don't say it. Allow me to feel it. And for me to say it makes more sense than you saying it, because the way I feel that this place is a much more safe place is so different from how you would probably want to perceive it.
So we have to look
Right?
at from
So
their point of view versus we what we think is the ideal safe place, but their view of safe
absolutely.
is totally different. And so they're asking us,
Yeah.
show me how you can do it. You know how it resonates with them.
Yeah. Yeah. So, as they say in our facility, so it's a combination of psychosocial interventions or psychological interventions, clinical social interventions, in terms of understanding who their support systems are. How do you work with the support systems as they access their acute care interventions? In addition to that, how do you focus on occasional training needs? How do you build skills in them so that as soon as they go back, are they in a position to kind of proceed with their livelihood options? Are they able to persevere and then live with the kind of options that we give them in terms of social care packages? How do you offer continuity of care as soon as you step out of the facility? These things are very important. And as you stay inside the facility, what also would be important is to address early childhood trauma, any trauma related to their adulthood and their abusive environment, and what is it that is making, let's see, mental health symptoms, symptomatology, that's a manifestation of trauma.
Yes.
So you can settle down that with any sort of pharmacological interventions. But what doesn't go away is the visual image of my father hitting me.
That stays
What
with
doesn't go
you.
away? That stays in your head throughout your life. Now, that is what we need to actually help individuals to probably deal with, rather than just saying that, yes, your father was like that, move on.
No, you have to go
Your
back to
mother,
that particular stage in life and heal that inner child, whatever they
yes,
went through, because that is where the trauma is stuck. If you don't heal that
absolutely.
space,
Absolutely.
it's just you're trying to only camouflage that. No matter what you're trying to say, at some point, some triggers will definitely evoke that particular experience again in their life. Although we are trying to tell them, forget about it, he's completely changed now, and that happened when you were 13 years old. But that inner child is still holding on to that memory, and going and making sure that that inner child is healed. Otherwise, there are repercussions later in the age. It come, like you said, rightfully said, it will manifest in a totally different form in the future.
Yeah. Absolutely. And what is important is not to nullifying the experience. We're not saying that it happened a long time ago. You just move on. We're not saying all of that. Accept the fact it's happened to you.
Yeah.
It was wrong. It was so wrong that it happened. It's so unfortunate that it happened to you. But if you have plans to move forward, how can I be of help? And it's also okay not to move forward. Moving forward is not the only option, right? So if you want to stay depressed, if you don't want to do anything, if you want to just lie down in your bed, it's okay.
But
Because
then
that's
that's your
also
choice. That's a
something.
conscious choice you're making. So you're basically laying it out to them like, okay, we are acknowledging whatever happened is not something which was insignificant. It was a significant, thing which happened in your life. But in order for you to move forward, you have to find a mechanism to cope with it so that you can move on. Or else, these are the repercussions. These are the things what is there. So it's up to them to choose which path they want to take, which actually is good, right? Rather
Absolutely.
than negating something which did not even happen, you're basically saying, no,
Yeah.
it did happen. It was such a horrible thing to happen in your life, and we completely
Yeah.
acknowledge it. Wow. So I think
And they
that
want
itself,
to hear that.
somebody
They
acknowledging
want
that.
to hear that.
Yeah. Saying that it was,
Somebody acknowledging that and saying that it was so unfair it happened to you, rather than saying, sure, I understand, Preetha. More than that, I want somebody to say, hey, Archana, this couldn't have happened to you. How terrible that can be.
yeah. That is
And I need
it.
to hear
That
that.
even a normal human being, for that matter, right? Let's say we all have our own personal problems we all deal with. When we go and confide in our own family member or a friend, we are not looking to anybody to judge us or give a solution. All we are telling, acknowledge that what we went through and give us a shoulder to cry, or at least say, yes, that was a very terrible thing to happen. And so that
Yeah.
you're validating what we're going through. All we are asking is a validation at that point, right? So I can only imagine somebody is like mentally unstable. They're looking for that anchor, somebody to tell them, I'm hearing you, I'm listening to you, and whatever you went through was really horrible. I like the way you're approaching it. That's beautiful. So, Archana, I had all the questions written, and then through your conversation, you kind of covered everything what I had, because I had something which I wanted to ask about, like impactful incident, and you told about this person. Her name is Varsha, I believe, and so I think you kind of covered everything. So now I want to focus on like. Looking ahead, what are some of the long-term goals you have for the emergency care and recovery centers? Like, are there any new projects or initiatives that you're particularly excited about?
Yeah. So as you know, we've also scaled up the emergency care and recovery model across 10 districts in Tamil Nadu. We're working with the National Health Mission quite closely. So they have adopted, the government of Tamil Nadu has adopted a model and has scaled up across the 10 districts. So I also work very closely with the government as far as the health sector is concerned, the health department is concerned.
Very
So
good.
my dream is to have ECRCs across other states as well. In Tamil Nadu, I think in a span of 1 year, I think ECRC will be scaled up across all the 38 districts,
Oh my God,
which
that
is
is beautiful. That's so nice that
yeah,
the government has recognized and also understood the need for such centers, and they are working,
yeah.
hand in hand with you. That's wonderful.
And the Banyan has taken the lead in monitoring. It has a committee in place and monitors the entire systems across all these districts with the government. So we chair all the meetings with the government, and we've kind of designed these protocols. So they've adopted our protocols as well. So gradually, we're also seeing that other states are coming forward, say that we would also like to collaborate with you. So I think the kind of outcomes that we've seen as far as ECRC is concerned, Preetha, is people have stopped coming to the cities to access care.
Oh,
People
okay.
are having, see, ECRC is not just for homeless people. It's also for people with families who are at the verge of becoming homeless. So
Okay.
it can be, okay, so this person whom I just spoke about, she has a master's in special education. Her father was a HR head. Okay, he was heading about 1,000 member team. He was in a leadership role. The mother was a bank manager. So it is not at all specific to the homelessness is not specific to the lower end economic strata, but it can happen to I or to you.
Yes,
Okay. Now,
absolutely.
in addition to that, for people who live in rural districts, earlier they would sell the last piece of land that they have, they would sell the last piece of gold that they have to come all the way to access a state mental hospital in Chennai. I'm sure it's the same pattern in other states as well, because that's the only place where we have free government facilities. Now, people are accessing our emergency care and recovery centers in the same district headquarters hospitals.
Oh, in the tier two and tier three cities rather than coming to Chennai. Wow.
Right. That's what we've created. And also infusing mental health care as part of the public health system. So
Oh,
you're
nice.
not so you have a medical college and hospital run by the government. You have a separate block for people with homeless people. So you don't know what for you're getting admitted. Maybe for it's for cardiac issues or for general health issues. So people like the fact that okay, you have a mental health ward as part of other departments
So they're
rather
not
than having
isolated. They're not isolated and looked down upon, or something is wrong with them. They're like part of the rest of the
a
ecosystem. Oh,
yeah,
nice.
yeah. So that's something that people came back and told us. We're so glad that it's not like a one-off kind of a center. So people know whoever's walking into the Banyan is walking in for a mental health issue. But there in the government people, it's you're part of the entire crowd. So anybody can walk in and walk out. Another thing is that this private public partnership, that the P2P model is working very well, where the government has also seen perks in terms of collaborating with a parent NGO, that's the Banyan, and having several other smaller NGOs in the local districts. So we never wanted to, as an organization, monopolize any of our care approaches. We were quite open to the fact that we wanted to take along other smaller NGOs along with us. So
Oh,
over a
nice.
period of
So there's a lot
two
of collaboration, right? Like only then this, whatever you're doing, this emergency care can be spread really faster, because then you'll
years,
have,
yeah,
it's like train the trainer concept. So there are going to be like it's like
Absolutely.
a relay system, right? You pass on the baton, so somebody else can pass on the baton, and so it is actually implemented much faster rather than monopolizing it. Then what happens is the care will not be shared to all the different states, and millions of people cannot access this at all. So I love the way that your organization is designing the whole thing, and then you are doing a POC, making sure that the proof of concept works, correcting the nuances, and now you got a working model, and now let's take it and share it with everybody. That's
Yeah,
wonderful.
yeah,
That's really
yeah.
wonderful.
So my dream is to open up this place as much as we can for people to walk in to access services. At the same time, also for students, okay, from across different places, because usually people who intern at NGOs are a different category. But
Yes.
rather, I would see this place as where people, students who can also afford, students who are also part of a medical institution or any other academic institution or part of prestigious universities should be in a position to come and expose themselves to rendering medical services to people who cannot afford. So I think that convergence needs to happen at some point or the other. Otherwise, a lot of people call me as well. Okay, you're into social service now. Yeah, Archana, you were trained for a particular purpose. What are you doing now? Right? But rather, I feel this is the need of the hour. This is not, you don't have to be a good Samaritan to do this, but this is science. This is scientific evidence that people do not have access to care, and therefore you are creating services for people to access and enable that sort of care. Right? So people don't get that part. So people are creating more and more services only for people who can
Afford
only
it,
for the privilege.
privilege. And everybody, I was talking yesterday, I was telling like, uh, you talk about ESG, environment, social governance, and everybody speaks about S, but there is no focus on social sustainability. What is social sustainability? Unless the human beings living in this environment is living abundantly with with a balanced body, mind, and soul, there is no social sustainability. If the humans who are the inhabitants of this planet is not in the right mindset, how will the environment be right? So we are not looking at the correlation between the environment, social governance aspect. There's so much of focus today about environment, climate change, and I'm really grateful for that. That is absolutely needed. Having said that, the social sustainability part, nobody takes care into account. And that in that, mental health is a huge component, and nobody wants to speak about it. Like you said, right? All the advancements in healthcare is only for the folks who can afford it, who has that liquid cash, or they are in that hierarchy of growth where they can actually afford that kind of care. But there are people like what we discussed thus far, they can't even think about that kind of a treatment. So what about them? So you brought up a great point. So I know it's getting late for you, and it's also getting late for me. It's like 12 in the morning for me. So
Okay.
it's okay. I really enjoy having these conversations. So I want to ask the last question to you. Lastly, for those interested in entering the field of mental health, we were actually just talking about the convergence, particularly in roles similar to yours. What advice would you offer them, and based on your extensive experience?
So, what I would suggest for the youth is that be real in clinical practice. I think that's very important. So, it's not about your personal accomplishments, but rather looking at how you can bring a convergence between what you've read, what you see in theory, to what is there in ground reality. And within that, being yourself is quite important. So, don't get lost over a period of time because you need to keep pace with advancements in the health sector and the mental health sector. But what's important is if there is a genuine change in you, because those changes need to happen in you for you to understand that yes, I'm able to process this. Only then you'll be able to see things from a different lens. Or else you will continue to see until your last breath as a practitioner through the lens of only somebody who's dead and gone 100 years ago. Like
Yeah.
I was taught about Freud several times, but I never understood what life was until I saw it myself. Sure,
Amen.
Freud's models and theories are very important, but I think the youth need to understand that you're capable enough to open up your arenas in terms of how diversely you can understand different groups of people and also understand mental health from a different lens where it doesn't have to be looked at from the lens of ill health at all. But rather, I think I always felt, Preeta, that people with mental health issues are the most honest people. Okay, so somewhere I keep coping for what? Because I don't want anybody to feel that Archana isn't a loser. But
And
for
they
people
don't
who
want
give
they
up
don't
on
want to hurt
themselves,
anyone. They will take all that burden on themselves, but they will never
yeah,
want to hurt because they always think about the other person. And guess what? They are the ones who are taken advantage of. Like earlier we said, right?
yeah,
They've promised a lot of things, and they are deceived because, and they are very gullible as well because they believe the other person so easily. And I've seen this so many times in my life, and they are the ones who go through this mental trauma because they suppress everything within themselves, right? And they can't even tell it to anybody outside. And eventually, it comes to a tipping point where it completely goes out of
it
control.
does, it does. So I want the youth as well to understand this from on a serious note because mental health challenges is going to be on the increase. The more and more you get to see, so now you have the internet, you have phone addiction to whatnot, you have access to all kinds of information, so you will be drawing in very new things when compared to what it was into a box where it's only schizophrenia, depression, whatsoever. Now I think that you have an array of options to deal with. So if that's the case, you need to be better prepared in terms of how you can go back to basics, how you can connect with nature, how you
Yes.
can be all the more worried about climate change. All these things should have an impact on you and not just look about your accomplishment as a practitioner, but rather look at mental health as a good mix of everything. I think that would be a better thing to do.
Wonderful. So I think we've come to a close. So thank you so much for joining us today. It's been a
Thank you.
truly enlightening conversation with Archana Padmakar, whose dedication and expertise are making a significant difference at the Banyan. Her insights remind us of the power of compassionate and innovative approaches in mental health care, especially in emergency and recovery settings. So, Archana, as a final thought, do you want to share something with us before you move, go?
What I would take away also from this podcast and also leave a message is that just be very genuine. I think as individuals, as practitioners, or if you're even at the receiving end, just be genuine. Just be straightforward. Just be very honest in terms of what exactly you want to see through as far as service delivery is concerned. Because the sector has too many people where they can be quite deceptive. They can give you sugary coated packages. But if you can be very real, if you can walk through the journey of a person with distress, I think that counts in more as a practitioner than anything else. So these are my takeaways, Preeta.
Thank you so much. To the listeners, we hope this discussion has inspired you and deepened your understanding of the crucial work being done to support those in urgent need. Remember, each of us has the potential to contribute to a more understanding and supportive society. Stay tuned for more stories that move and motivate us to think globally and act locally. Here on Planet Forward with Preetha, thank you for listening. And until next time, keep pushing the planet forward. Thank you so much, Archana.
Thank you.